when we see the patient, AI can be used to summarize an interview, summarize clinical information, take it and condense it into what's important and lay that out for the provider. There could also be AI use for suggestions for adding content that may have been missed or not asked during interview. I think it's a very exciting time right now in healthcare. I think it's a very exciting time right now in healthcare, particularly because I think AI, the ability to really support providers in many, many ways. One of the primary things that we leverage it, is to reduce administrative burden for providers. So providers can focus more on clinical care and less on the increasing amount of administrative tasks that we've been asked to do since the start of time. Prior to the encounters, we are gathering a lot of data, as much data as we can, information from the patient, clinical history from the patient. When we see the patient, AI can be used to summarize an interview, summarize clinical information, take it and condense it into what's important and lay that out for the provider. One thing we're going to be doing here, particularly because of addiction care, is quality of life surveys. I think one piece of information that we often, due to various reasons, don't collect. And I think ultimately you have to prove out what your care is doing for the patient, how meaningful it is, how important it is to their functioning. And so quality of life surveys will be an important part of what we do and track here, particularly for addiction. There could also be AI use for suggestions for adding content that may have been missed or not asked during interviews. And this would be done at the point of care during the call, so that there could be additional information can be asked, and you could be prompted to ask for additional information that's important to not only good note, but also geared towards care requirements and what they might want to know. There's a lot of different uses for AI, and we're very tech forward and optimistic that what we build here with our engineering team is going to be serving our patients well and serving our providers well.